Government yesterday unveiled a 1 percentage point CPF contribution increase for all workers from employers. Do you think that this is enough? Because the entire increase will go into the MediSave accounts to help them pay for their healthcare costs. Do you think this is a good move from the government, and is it enough to help them?
Well, I think that it recognizes that healthcare costs are rising rapidly. So any amount, whether it's 1% or really 2%, it really would be helpful. But I think it's important to remember some of the basic truths that really healthcare demand is practically infinite. Healthcare resources are very finite. So at some point in time, whether this year, whether 5 years from now, governments and really societies need to make those hard choices and really ask this question: what price is life? How much are we prepared to invest as individuals and really as a country?
But the fact of the matter is that there will never be enough. I mean, it's going to be infinite. The fact of the matter is that we're starting somewhere, and I think the fact of the matter is that we do have resources to start somewhere. I think that's a good start.
What do you think of the healthcare measures to help with Singaporeans' costs, in medical costs and healthcare costs?
Well, I think it will be politically extremely popular because people are increasingly worried about healthcare costs. But I think that the government has actually to do more to dampen the rising cost of healthcare. Because it's really not enough to say that we're putting in X million or X billion dollars if the rate of medical inflation just continues to rise, right? And remember that a lot of these subsidies, they're essentially packaged as an overall percentage. And if the absolute dollar value for a consultation in the hospital and in the clinic goes up, then it really dampens the effective benefit. So I am encouraged, and I hope to hear more from what Minister Gan really during the overall COS speeches. What is the ministry going to do to really tackle head-on the rising healthcare costs?
I think escalating healthcare costs is primary because acute care just grew and grew and grew because people were not taking advantage of primary care and managing their health problems early and preventing problems. So all roads led to that road called a hospital, and everybody ended up there. So the key of any strategy of healthy population, but healthy aging population, they keep them healthy. And previously, I think that perhaps the ministry thought that, outpatient care is inexpensive, everyone can afford. But in fact, actually it's not. Particularly for the lower income, well, if I feel okay, I may have hypertension, I may have diabetes, I may have hyperlipid, and I have every risk, but I feel okay, and it's all this most expensive. I have to take time, take money, I'm just not going to go. We see that all the time. They don't go. And you don't grow at 60 or 65. You start when you're 30, 40. So you have to make sure that they have the financial support so they can have good health-seeking behavior so that you can manage your chronic diseases.
Even before the symptom arises.
Correct. So you pick it up early, you manage it, you control it. Chronic disease is not horrible until you get a stroke or things like that, or a heart attack. So you can prevent those.